clinic, holistic, outcome based, planned, early evaluation and intervention. A multidisciplinary clinic for children with cerebral palsy at the pediatric OPD Bharati Hospital. What is cerebral palsy? Cerebral palsy is defined as a group of disorders of the development mainly of movement and posture, but this may be accompanied by disturbances of sensation, perception, cognition, communication, and behavior, along with comorbidities like epilepsy and secondary musculoskeletal problems. Thus, there are various care aspects in CP, that is cerebral palsy. Now, of course, the motor delay, the tone, the posture, the communication difficulties, the sensory issues like vision and hearing, the fine motor, play, the activities of daily living, feeding, nutrition, bone health, cognition, and behavior. And thus, obviously, the approach for intervention is what is recommended is a multidisciplinary, comprehensive care plan approach. For children with cerebral palsy, the key to better outcomes is early identification of the evolving signs of cerebral palsy, especially in the at-risk population, and thus the initiation of early intervention early in the child's life may give better outcomes later long term. Having said this, initially there should be an assessment and evaluation of the child's overall development in all the domains along with functional outcomes outlined. And this will give rise to a goal-based intervention plan, keeping in mind the child's holistic development, behavior, and other needs of the child, depending on sensory needs like hearing, vision, adaptive skills, etc. Now, these needs or the domains of development to be focused on may change over the child's growing years. Whether it is motor, whether it is fine motor, whether it is communication, whether it is behavior, whether it is academics, whether it is the comorbidities, everything has to be taken into consideration while formulating the plan, along with regular monitoring and review of the child's development and behavior, and advocacy and family support as needed over the ongoing process and as the child grows up. So this is an ongoing process, and of course all the team members in the multidisciplinary plan have to work hand in hand for the child's overall progress and for the family support.
I'm happy to be part of the multidisciplinary cerebral palsy clinic at the Bharati Vidyapeeth Medical College. Intervention of the orthopedic variety in CP kids is the cornerstone to make the lives of these children independent and pain-free. We can broadly categorize them into two groups, the walkers and the non-walkers. In the walkers, our endeavor should be to make the tendons loose enough so that they can ambulate independently or with calipers or maybe walking aids. But it's equally important to detect hip dislocations by surveillance in the non-walking category so that they don't have postural issues, nursing issues, and can lead a pain-free wheelchair life.
So almost 20 to 60% children with cerebral palsy may have recurrent seizures, what is known as epilepsy. So these children will require specialized investigations like EEG and may require anti-epileptic drugs for a prolonged period of time, almost at least 2 to 3 years of seizure freedom. Now, some of the genetic and metabolic disorders may mimic cerebral palsy. That means they also have developmental delay, motor problems, etc. But many of these metabolic disorders may have some specific treatment, so they can be benefited, as well as if they are not picked up in time, there is always a risk that the next pregnancy may also be affected. So there is a need for the family to consult the relevant experts so that they are guided properly for the next sibling.
The bone health in a child with cerebral palsy is often neglected. The risk is very high, 20%. 1 in 5 children will get fragility fracture at some point. This high risk is due to several reasons, such as dietary deficiency, lack of weight bearing, medications, so forth and so on. The fracture, if it happens, needs care by a pediatric orthopedic surgeon and a multidisciplinary team. Fracture prevention is far better than cure, and every attempt should be made to improve bone health of a child with cerebral palsy and prevent fragility fractures.
As a part of this team, I would be looking into growth and growth related issues, including nutritional problems that are so common in these children and also pubertal issues. I would be happy to take care of their immunizations and also facilitate the multidisciplinary care that these children need.
Good education and professional practices turn out wonderful professionals. It enhances analytical and observational skills, which help them to intervene better. It enables them to expand their knowledge and expertise. Additionally, they become more organized and finer at the time management. It encourages them to be a deep thinker. Good education and professional practice builds a skillful professionals which provides a high quality of services to the organization.
Physiotherapist plays a central role in the management of children with cerebral palsy. Training for physiotherapist professionals should ensure to acquire necessary skills to meet the need of healthcare model which prioritize multidisciplinary and integrated team activities to improve quality of life in children with cerebral palsy.
Walking is a motor milestone which is of very great importance to the parents of children with cerebral palsy. Thus, discussion of the walking and the mobility goals should be made as early as possible with the family, caregivers and the child's physician. The goals should be realistic and optimistic. Thus, early detection of the walking or the mobility goals should be made, which will help in the good prognosis of the children with cerebral palsy.
Deformities cannot be reversed without surgical intervention. So it's always better to prevent deformities with regular exercise regime. Exercise for training muscle help to improve strength, flexibility and joint mobility. We can provide guidance on how caretaker can continue muscle training and exercise at home between therapy visits.
Occupational therapy deals with fine motor activities, includes finger dexterity and hand coordination. These activities are important to achieve independence in daily living needs.
Most of the children with cerebral palsy may have difficulty in developing verbal communication and may require the help of a speech-language pathologist. Some of them do develop speech, but there are many who will be non-verbal and may have to use communication boards which have pictures, words or sentences written, or may have to use high-tech devices like the iPads or the tablets with specific software programs which convert these pictures or letters pointed by the child into speech. These are the alternative or augmentative modes of communication that a child with cerebral palsy can use.
These children may also need feeding evaluation and guidance to ensure better nutrition.
Children with cerebral palsy many a time shows difficulty in cognitive areas. They also show some cognitive impairments which include delayed language, difficulty in concentration, reading, writing, counting. They also show some issues in problem solving areas as well as when it comes to expressing their emotions, which include anxiety or anger issues. For them, it is important that we choose right schooling methods and schooling techniques which will be helpful for them and make their learning easier.
Children with cerebral palsy shows difficulties in interacting, playing, learning and their daily living functioning. Behavioral modification techniques help these children and their parents as well to cope with such problems. So behavioral therapy is recommended for these children and their parents.